Hi, greetings and welcome. I'm Karen Landon, Director of Solutions Marketing for Nuance Healthcare. Welcome to our presentation this afternoon, where we'll be talking about workflow solutions to streamline documentation and coding in the surgical suite. We're really excited and pleased to be able to bring this content to you today. And thanks for making time out of your busy day to join with us. We understand the challenges that you face each day, improving the quality of care you offer your patients and your community, and doing so with efficiency and while also managing costs. We're really pleased to be able to share with you an approach to engaging your surgeons and a better documentation experience for improved quality of care and communications between care members, resulting in more accurate reimbursement for your organization and for the physicians themselves. You may have heard recently that Nuance has announced an expansion of our artificial intelligence and documentation solutions for physicians through a partnership with an organization called Vincari. We're very excited to be working with them as the leading solution for surgical documentation. And we're pleased to be able to bring the story and share the solution with you today. So a quick introduction of the team. I'm Karen Landon. I'm the Director of Healthcare Solutions Marketing. I have over 30 years experience working in healthcare IT and with advanced clinical systems and physician engagement like the solution that we're about to see today. I also have with me Michael Damrich, the physician experience specialist from Vincari, who's been with them since pretty much the beginning of the organization and has a ton of experience in the space and very successful physician engagement strategies and expertise. And also Mercedes Dellum. Dr. Dellum has over 30 years of clinical practice as a cardiothoracic surgeon with numerous leadership roles in both hospital settings, private practice, and integrated medical practices. Her expertise includes clinical outcomes management, most recently as the chairman of Performance Improvement Council at the Cleveland Clinic in Florida, and previously as the medical director of clinical outcomes for Washington Hospital Center, and numerous other leadership positions in the industry. As a regional medical director with Nuance, Dr. Dellum serves to help our clients engage and involve their medical staff in clinical documentation improvement initiatives. So let's take a little bit of a look at the agenda that we'll be covering today. We'll talk specifically about a new approach to surgical documentation. I'll open with a review of the artificial intelligence-enabled solutions that we've been working on at Nuance and with Vincari, with a focus on physician engagement in this session. We'll take a look at streamlined documentation and coding for surgeons and proceduralists and an overview of the solution. And then we'll actually take a closer look at the solution itself, and Michael will give you a demonstration of the product and some history and background on the company as well. We'll have a bit of a discussion with Dr. Dellum about the surgeon's perspective on the solution, and then there'll be plenty of time for questions and next steps. Before we get into the content, just to remind you, at the bottom of the screen, you have access to a Q&A window. You can type your questions in throughout the presentation, and we'll address them as we can, and we'll also leave time at the end to cover the Q&A as well. So let's dive in. I'd like to take a little bit of time to talk about Nuance's approach to building solutions with artificial intelligence. We've been focused on AI for many years, with 3 decades of experience in the artificial intelligence space, although you may not be as familiar on the healthcare side with what we've been doing. But you have probably used Nuance AI at some point when you talked to your car, when you called your bank or an airline, or spoke to a virtual assistant and it worked, or you refilled a prescription of all these tasks. They all leverage Nuance AI in the background. You may not be aware of that, but they actually do. Our goal is to assist people to amplify their intelligence rather than replacing them. Our goal is to make the task easier for the people who are doing these jobs, to make them more accurate and more efficient. And because of our depth of experience, we've been able to bring many techniques to bear with solutions for healthcare. That includes things like speech recognition. You may be familiar with our Dragon solution, natural language processing models, approaches to machine learning and deep learning, as well as our experience with other computer-assisted models that we bring to our solutions to help drive the most appropriate outcomes for our clients. Over on the right-hand side, you can see there are lots of different areas that we cover in the healthcare space. Today, we'll shine the spotlight on computer-assisted solutions to help improve the documentation capture experience for surgeons and proceduralists. And this is where Vincari fits in. Our core solution is designed to help the physician in the operating room, to make it easy for them to remember and document everything that they need to do. We often find, and you probably do as well, that poor documentation or lack of sufficient details in documentation leaves money on the table. And then it also isn't immediately available to help coordinate care between the members of the care team. The difference in this approach that we're bringing to you is the solution was born in the operating room and designed by surgeons for surgeons. All the features and enhancements that we've brought to bear with this product have come from our physician clients, and they've really helped shape and bring it to where it is today. We changed the way physicians capture, leverage, and deliver patient information. So why Nuance and Vincari? Let's talk a little bit about some of the problems that we're trying to solve and how we're going about doing that. The first problem that we're solving is the rules around clinical documentation are constantly evolving. And as the rules change, it's hard for physicians to provide consistent information. We wanted to develop tools that at the point of care, no matter what the situation is that they choose, certain procedures and the appropriate questions will be asked of them at the right time. We'll help make it really easy for the physicians to capture information while they're thinking about it, that they're typically asked retrospectively by coding or CDI teams. The second problem that we're trying to solve is that physicians waste an extraordinary amount of time on repetitive tasks. We hear from all of our users that with EMRs, it feels like Groundhog Day every day. The systems don't really learn their habits, and you need to start from scratch every time to build documentation. So our solution was designed to leverage the physician's information using their own words and the way that they describe things, as well as other information that we can leverage from the chart, like existing diagnoses or scheduling information to make the physician more efficient at the point of care. And then lastly, connectivity is important. Making sure the information we do capture is sent to the appropriate system in a timely fashion, regardless of the EMR that the hospital is using or the physician practice is using. Once the physician completes their work in Vincari, that information is immediately sent back to the record so the care team, as well as coders and CDI teams, have everything that they need to know. And because we realize interoperability is extremely important, we view this as an IT light implementation, if you will, that leverages existing ADT, results feeds, scheduling feeds to make it easy and fast to get up and running, and less of a burden on the IT team that has to implement it as well. So what benefits have our clients been able to achieve and realize using this solution? Well, for the physician's office, eliminating dictation and accelerating the revenue cycle is probably one of the biggest benefits. While physicians are back in their office, they aren't waiting for op notes to come from the facility, charge capture information to come over as well, and avoid carrying index cards. We track the cases for the physicians as they use the system over time. So instead of just free-form dictation or other means of documentation, we learn what the physician commonly does and use that again for other purposes, like looking at case log information, analyzing top procedures, diagnoses, etc., to enable continuous process improvement for the practice and for the physician. Benefits for the hospital include streamlining the clinical documentation and coding process. We know this can go in circles often. As physician dictates, then they need to sign it. Queries may be necessary retrospectively. We're trying to make that a one-pass situation. It'll reduce coder queries by asking details at the point of care, while also accelerating the revenue cycle, making sure that all the downstream players have what they need. And transcription costs can go away as well because they're direct typing their information right into the EHR. And then for surgery centers, where the solution is also a key target, eliminating transcription costs is important to them. Many of these facilities still rely on paper and traditional dictation, as well as the same benefits that we talked about that we've seen for the office and the hospital around improved communication, engaged physicians, and more accurate reimbursement. The solution today has over 50 specialties. Among the highest volume that you can see include orthopedics, neurosurgery, OBGYN, endoscopy, including GI procedures, diagnostic procedures like cardiac cath, and so forth. There's a good deal of content in here to fit every specialty and every possible workflow. Basically, any specialties that are using the CPT manual are good candidates for the solution. And then just a quick overview of how it works, and then I'll transition to Michael shortly so you can actually see it. So the way Vincari supports physicians is by providing the right kind of advice and guidance at the right time in the workflow. Vincari connects with the office and hospital systems to provide access to daily surgery schedules and patient lists, and the mobile application makes that really easy, so that supports the preparation and planning process. Then when the physician's creating their note, Vincari helps guide that process for creating pre-op notes, post-op notes, providing advice around specificity of diagnoses and procedures in real time, so the physician can be sure that behind the scenes the right ICD-10 code and the right CPT codes can be applied. Complications and comorbidities are captured, and all that detail required to communicate to the rest of the care team are clear. When the physician signs the note, Vincari makes the signed report immediately available in the EMR for all care team members who need to see it. It also sends a suggested charge report with CPT codes to their office, eliminating the need to manually track professional charges. And then throughout this entire encounter, the CDI team as well as the care team has access to those signed reports so that they can continue to review the information and they can use that to communicate and coordinate care. So with that quick introduction, I'll turn it over to you, Michael, so you can show folks what the solution actually looks like, as well as a bit of a history on Vincari as an organization.
All right, perfect. Thank you, Karen. So as she introduced me briefly, my name is Michael Damrich. I am the Physician Experience Specialist at Vincari. I've been with the company for a little over 7 years now, with a main focus of working directly with our users and physician advisors to make sure that the product is, one, as intuitive as possible, and two, that it's solving the problems that Karen outlined a little bit earlier. It's also important, and a good way to get an idea of where this product was born is through Lucian Newman, our general surgeon and founder. He was one of those outlier physicians that a long time ago was very aware of the things that were being left on the table by surgeons due to poor documentation. He was operating at one hospital that had Epic, one hospital that had Cerner, and another and a surgery center that just relied on freeform dictation. And at all of those different facilities, one thing that was constant was that he was being queried for missing information. He felt like reports were being lost, and he was still in charge of really delivering index cards, if you will, or getting that information back to his office. And he knew that there had to be a better way. He also mentions often that physicians, surgeons especially, do not go to medical school because they like doing paperwork or administrative things. They go because they want to operate. And while they're in medical school, there's also very little education around documentation. And as we know today, it has become such an integral part of running a practice and running a hospital, is making sure that that documentation is accurate. And we see that the burden a lot of times has been passed from the physician to the hospital or facility through CDI teams who are constantly trying to hold educational events for the surgeons who oftentimes never show up, or they're trying to put sticky notes in the dictation lounge, and it's really just this game of cat and mouse. And so that's really the essence of where Vincari was born, is that the only way to consistently gather the appropriate information for the appropriate reimbursement is to put a tool in the hands of the surgeon immediately following an encounter, so that it eliminates some of the additional steps that they're doing to make them more efficient. And it also is going to gather all of that appropriate information. So with all of that being said, this application is a web-based application that's HIPAA compliant and hosted through AWS or Amazon Web Services. We make it, as Karen said, extremely IT light by utilizing some existing interfaces at whatever facility or whatever EMR you may be using. And we're also making strides in integrating this application even closer with some of the most popular EMRs to make that workflow as seamless as possible. So in this demonstration, I'm actually going to be logging through the Vincari web interface to walk through the product, but also know that this is also being used directly in line with the EMR, whichever EMR it may be. So the physician's still logging into one single place to do their orders, to do other things they must do, and then to complete that operative documentation they're accessing Vincari from that same screen. So with that being said, I'm going to go ahead and share my screen. And Karen, if you can just confirm that you can see my screen here with today's schedule.
Yep, looks great.
All right, perfect. So let's assume that I am Dr. John Williams, who is my sample orthopedic surgeon. As we mentioned, there's over 50 different specialties that are currently using this application. And the reason that we're able to be so widespread across the specialties is, one, it's going to learn this particular surgeon's behavior. So as they use the product, it's going to become faster and faster, and again, prompt that physician with things that they're constantly doing. And then also, all the data and all this information on the back end is actually managed by a data team on our side. So whereas in Epic or some other systems that allow you to create templates, if you will, and rely on the facility for management, and we see the balloon of those templates growing and it becomes unmanageable, all of the CPT and ICD-10 information as it's updated is being updated by our team as well. So let's assume that I've just completed surgery, and again, instead of picking up the dictaphone, dictating my op note, then potentially filling out that immediate post-procedure note as well, I'm going to complete all of those items in one workflow through Vincari. So I'll start by going to today's schedule. Again, this is going to leverage the scheduling information from your facility, and if it's integrated through the EMR you're using, the physician would be choosing their patient through the EMR the same way they would be choosing it today to do the other things as well. But from here, I'll choose my patient, and I'll select Begin Report. So when I hit Begin Report, it is going to take us into the Vincari operative workflow, which is designed to flow in the manner that surgeons have been dictating their entire career. The difference is that we're going to put that level of AI on top of that workflow to try and gather the information that's required and also notify that physician when more information is needed. Again, we're trying to take this away from a guessing game, and as Dr. Newman often says, is that physicians know the answers. A lot of times they just don't know the questions that are being asked. And when you force physicians to close their eyes and try and remember or regurgitate a note, a lot of times you're going to get the same inconsistencies, which again is where this visual workflow is designed to improve that. So starting on my preoperative diagnosis section, I'm actually going to walk through this the way that a physician would actually use it so you can get an idea of the speed, and then I'll kind of step back and walk through it to explain a little bit more. So based on my preoperative diagnosis from my commonly used list, I'll go ahead and choose osteoarthrosis of hip. I noticed that for ICD-10, that diagnosis isn't specific enough, so I'm going to be prompted immediately to say it was unilateral on the right side. And at that point, I've gotten my ICD-10 specificity, so I'll move on to post-op. A lot of times it is the same as the pre-op, so I'll go ahead and copy it over. However, I can add any additional post-op diagnoses as well. I'll move on to procedures performed. Based on the diagnoses I've selected, I'll choose from my related procedures of my total hip. I'll say it was on the right side. And each one of these questions that I'm answering are those ICD-10 questions required to get to that PCS code. So if I'm choosing a procedure like an excisional debridement or whichever procedure it may be, that is where those questions are going to be prompted to make sure that the appropriate information is gathered when it's on the physician's mind. So I'll move on to general information. Notice I have several fields here. The ones that are required are marked as red and require the physician to fill out before approving. But for my assistants, it's going to learn the different assistants that I've used in the past. I'll go to my blood loss. Again, it has learned the different items that I have used for this procedure in the past. And it also accepts any free-form text and works with the Dragon medical product, that voice recognition product as well, which I'll show in a moment. At that point, I've answered all the required questions, but I'll say no complications. We'll say anesthesia was general, sponge and needle count was correct, and then I'll move on to the technique module. So the first two modules are really aimed at gathering the codified or structured data where the technique is reserved for the physician's personal context, such as indications, findings, and then my actual description. This is where surgeons spend a lot of time regurgitating. A lot of times it's a lot of the same information. So we allow the physicians to actually save some very common items, such as my indications, which notice is going to leverage some of the information around the patient's demographics. And then it's going to allow me to save the text that I may be regurgitating over and over again around this procedure. This is also completely editable and works with, again, the Dragon products as well. So on to my findings. So again, based on the things I've found for this procedure in the past, I can go ahead and choose those, or if it's a more elaborate finding that's one-off, I can, again, use that voice-to-text or type there. Now, for my actual description of the procedure, notice this is where I can actually save as many different versions of this procedure. We know surgeons, there's not just one way, as Dr. DeLume may tell you, to do a cabbage. You may have on pump, you may have an off pump version, you may have with saphenous vein or with not. So there's all kinds of different nuances that the physician's able to save into this, again, to save them that time from dictating. It's completely editable if I want to add any other information, and I'll move on to risk factors. So the risk factor section is one more step to allow the physician to add any other comorbidities that may be relevant on this patient. This can be leveraged from the EMR as well to pull those diagnoses in, so that if things like congestive heart failure are in the chart as unspecific, this is one more opportunity for the physician to actually specify that, to give that most highest level of specificity. I'll go on to associated providers, typically from the facility as well, and this information is pre-populated, so I'll have the admitting primary care physician's names here, and I could easily choose who I wanted to have receive a copy of this report upon signature. I'll go to my charge capture. So this is where, instead of a physician filling out a super bill or filling out an index card to deliver back to their office, based on the documentation that is done, we're actually going to, the rules engine and artificial intelligence on the back end of this product is going to look at what was documented to provide that ICD-10 and CPT information to go back to my office as well. So at that point, I'll go to report preview. And on average, between 60 and 90 seconds, physicians are able to complete this entire workflow. And knowing that as soon as I e-sign this report, I'm not going to have to revisit it because I've already answered all of that ICD-10 information as well. So I'll come up here, I'll choose e-sign, and immediately that note is flowing back into the EMR. Because that final note is automatically there, I'm not having to do that second step of filling out an immediate post-procedure note. And then also that information is automatically sent downstream, again, to whoever it was that I had initiated it to. A few different outputs of this is one, this PDF of the report, which we like to send back for human consumption. Obviously, it's very clear. It's got all of the fields very neatly arranged and in a way that, again, physicians and downstream care have requested it to be. We also have an example of what this charge report would look like. Again, the codes that were provided are not printed on that final report. They're actually provided in a separate report that, again, can be delivered downstream to eliminate that process. So with that being said, Karen, I'll go ahead and pass. If there's any, let's see, I'm going to pass this back over to you, and then at the end, if we want to walk through another demonstration that's specific, I'll absolutely be more than happy to do that.
Sure. Thanks, Michael. Nice job. Mercedes, can you just check in, let me know that you're on the line still?
Yep, I'm here.
Okay, awesome.
I'm here.
Thanks. So
yeah.
Thank you. We're curious to ask you a few questions about your perspective on the solution and what you feel that this brings to surgeons. So my first question to you is, what are some of the challenges that surgeons face with clinical documentation?
Well, there's several. First off, I want to say this is a very elegant solution to this problem for surgeons, but we have issues on many levels. One, you really need to be very specific and detailed and complete about what we are documenting in the operative note, and I'll break it down to a couple of different areas. One, in the operative note, we need to be sure to capture all of the comorbidities. And that section with the risk factors, I think, is phenomenal, because that's where surgeons just blow by. We don't have time. We don't want to do it. So we don't even bother address that. And having that risk factor, that alone will incredibly change the risk of mortality and for patients. And like I said, this is a very critical area that surgeons miss. So from a quality and patient safety standpoint, that's a very important area. There is an article in American College of Surgeons talking about why you want to document. And one of the big areas is this quality and safety and the fact that they're risk adjusted. So sorry to belabor that point, but I think that's a very important point with surgeons. So that's one area to capture it. The other areas within, again, documenting how the procedure itself. A lot of times we'll blow by all the other aspects. Like, for example, if you're doing an abdominal procedure and you had to do a gallbladder procedure that you didn't expect to. If we don't detail that, then that won't come out as a separate procedure. So it forces us to write more detail, but in a rapid fashion. And so it allows us not to miss the pertinent points. And I think that's a very important part of this. And then, of course, the code capture is important, because that'll immediately go. You don't have to worry about, as you mentioned before, taking your 3x5 card and writing it down and sending it to the office. And then the other aspect from a quality standpoint is immediately it will get onto the chart, and for the rest of the care providers to see, for example, with high-risk patients going to the unit, they know exactly what you did. So I think on all levels, this is very, very important for us. And then streamlining, it'll take a little time up front for surgeons to streamline it for themselves, but not that much. And then the final aspect of it is, of course, frequently in surgery, you're finishing one case and some other emergency pops up. This, again, allows the workflow, and it will improve surgeons' quality of life and efficiency tremendously. I think that's going to be the huge point for surgeons.
Yeah, I think we've spent a lot of time talking about the documentation process and focus on documentation, but it's really about helping to make sure that the experience that the surgeons have in capturing that information about the patient is as easy and painless as possible. Often what we find is in many organizations, the surgeons and proceduralists are some of the last holdouts who are still using traditional transcription, or in some cases handwriting their post-op notes. So my next question to you is, what are your perspectives on this approach and what it offers over those traditional dictation methods, or even other methods using the documentation in the EHR? Talk a little bit more, if you would, about this is a one and done situation as opposed to having to create multiple sets of documentation.
Oh, absolutely. And I think the time saving and the accuracy and the completeness of it is very important. And this will allow surgeons to get the completeness of this very quickly, and they can move on. So, whereas you dread going to go and do your op note, it'll be done, it'll be there, it'll be on the chart. It just makes it so fast and so complete that and the quality results from this will be phenomenal. So I think from your working standpoint, everything is there, it's all pulled in, you're not going to miss anything, because it's very hard to remember, especially in these complex patients, all of the problems associated with them. So you'll be able to readily identify those and complete your op note in a timely fashion, so you can move on to the next patient or what you have to do, knowing that everything was done completely.
Sure, I think that makes a lot of sense. So at this point, we'd like to open it up to the audience to ask your questions. Just a quick reminder that you can submit them through the Q&A window at the bottom of your screen, and we can address as many as we can in the time that we have left. So Michael, this one's for you. We have a question from the group. Are the CPT codes assigned by the rules engine, or does the surgeon select codes from a pick list?
So great question. So they are assigned by the rules engine. So based on the way I answer those questions after choosing the procedure from the procedure performed, it's going to run those different answers. So if there's a location, if there's the depth, if there's size, you know, for example, excisional debridement, if I choose that it's over 25, if I type in that it's 34 centimeters, then it's actually going to give me the two codes, one for the first 25 and then one for the additional. So it's not, that was another thing that Dr. Newman in the origination of this product, he never wanted surgeons to feel like coders. Again, they didn't go to medical school to be coders. They went to medical school to be surgeons. So that's why you don't necessarily see codes anywhere else in the product. We just want you to gather the right information, and then the codes will be assigned there. Now, it is important to notice it's not designed either to replace the coders in a sense that it's not looking at bundling rules or actually trying to do the actual billing. We're providing all the codes based on the information of the physician, and then it's still up to the coder to actually do any bundling or things that are required at that nature. Whereas we see, you know, there's a vast majority of procedures that come out with the appropriate code where no bundling or anything like that is required. But right, so based on the questions answered, it's going to provide the CPT codes that are based on those questions.
Yeah, Karen, can I
Sure,
just swing?
thanks.
I think
Sure.
that's a
Yeah,
great
absolutely.
point, Michael, because that will take away the confusion that surgeons have, you know, or any doctor, actually. I think this is usable over any specialist because, you know, when that list comes up and you're like, oh, which one should I choose? Because this is based really on the clinical, the documentation, the AI, it will distill down and allow the physicians to choose the right code. So this will, again, the time saving for the physician and the accuracy of this, I think, is the elegance of the solution.
Right, thanks. Michael, this other question is for you as well. So I can imagine folks who are seeing this who aren't surgeons may think, well, will my physicians actually use it? And I'm sure that's a common question that you get. So maybe if you could elaborate a little bit on what you see, you know, initially when you're bringing the solution to an organization, what kind of the thought process is on who needs to see it and when, and then what our traditional physician adoption rate has been, which actually has been quite phenomenal. So if you could share that with us.
Right, so that is probably the most common question that we get asked. A lot of times we'll go in at the beginning of a sales process because the product has been seen by an administrator or a CFO that may understand some of the benefits. There's all thumbs up in the room, and then the next question, like you mentioned, is always, will my physicians use this? We have about an 84% adoption rate across all of our facilities where it's completely it's not mandatory to be used. So at each one of those facilities, they've just opened it up. We see a lot of physicians. There may be, you know, when we start with some of the highest volume physicians at a facility, a lot of times those are the most vocal. And this really becomes kind of a around the water cooler conversation that we may have one physician who says, I'm not going to use it, but then as soon as they see you know, physician B over there actually using it, and they're like, I can't believe you got Dr. Smith to use it. Maybe I do need to give it a try. We get such high adoption because we tried to simplify it, not build this super elaborate tool on the front end where physicians feel like there's buttons all over the page. Dr. Newman from the very beginning had said, I want this to feel like software for dummies. So a lot of times when physicians, they may, you know, we'll have them say before they even see the product, I don't want to do anything different. I've been dictating my whole career. And as soon as we actually get the opportunity for them to see the product and actually do a case or two, and that snowball, if you will, starts rolling and it starts to learn the things that they were going to regurgitate, we start to win them over. We also have a lot of times, if there are templates or things that exist at a facility, we're able to take some of those and import them into the system before a go live. And especially for those physicians, there's always that one that they say, you are never going to get this physician on. And we like to take from our implementation side, which is also a little bit different than a lot of products you would be used to, is that we like to do more of a hands-on and import some information that we can gather from some old op notes, so that when we have that first opportunity to work with problem child physician, they're able to see immediately their language that's in there, and again, recognize how this is going to save them not only time on the actual creation of the document, but time revisiting documentation, which is really one of the biggest time savers, because a lot of times surgeons can dictate and complete Vincari in a roughly the same amount of time. However, the output is apples and oranges, and the revisiting is a complete time saver for the physician there as well.
Thanks. Speaking about time, just to let everyone know, could you talk about how long it takes to do a typical implementation? Maybe what specialties you start with, and then, you know, at about what point does the organization start to really see a reduction in transcription and benefit from the improved quality of the documentation?
Right. So it obviously varies across mainly the size of the facility. So whether you've got 2 ORs or 12 ORs really determines how much time we're going to spend on site. We offer a lot of different implementation methodologies, such as train the trainer. However, our most effective is when we bring our reps on site. Typically, so if you've got around 20 surgeons, we may spend 2 weeks on site in the operating room if the physician invites you in, or in the actual recovery room typically is where we are, where a lot of documentation, basically anywhere where the physicians are going to be doing their documentation. We introduce ourselves before, we work with them and help them build their cases with live cases, not a classroom setting where physicians, you know, half of them may come and then when they leave, they're not going to remember their login. This is something that we actually work and really hold their hand to allow them, because a lot of times physicians will say, I don't want to use a new product before ever looking at it. Yet if you have the opportunity to show it to them, show them the mobile app, show them how all of this stuff I just showed you can be done from your phone or from an iPad, they start to, again, they start to recognize that. And so typically, to answer your question again, typically anywhere from 2 weeks to a month, depending on the number of surgeons at your facility, is how much time we spend on site. And then for a physician to become competent on the product, we have, again, that varies, but to answer, we've got some physicians, you give them their login and you never have to show them again. But the ones that are on the higher end of the spectrum, your 65, your 70-year-old surgeons that are still hanging around, that are doing still several cases, typically anywhere from 5 to 10 sessions where you're just documenting one procedure with them. They understand the navigation, they understand, you know, how to choose their procedures and some of the other little ins and out features that I didn't necessarily get to today. But it's that's typically the rollout process. That's
perfect. Thanks. Another question, back to the artificial intelligence behind the scenes. Do you have any data to show the percentage of accuracy in the CPT code capture, or basically any of the code capture and assignment that's happening behind the scenes? So in terms of comparing it to really what was actually billed, we haven't done anything where we're actually doing a comparison there. However, based on just my experience in working with the physician practices, the feedback that we get from the coders is usually extremely positive. Obviously, we could definitely benefit from having some real hardline data around what was actually billed versus the codes that Vincari produced. However, again, just based on experience,
we, from both facility and practice, usually get extremely high compliment rates, if you will, on what we're providing back. Again, just one more from my personal experience. My father is also a cardiothoracic surgeon, which I guess gave me the opportunity to understand kind of the way that they operate, understand kind of the way physicians think. And his practice has been using the product for about 5 years now. And each Christmas, I receive a gift from their office manager for several different reasons. One, because of the efficiency that we provide them, and then also because of the ability for us to export this data for like College of Surgeons and recertification. Because it's capturing all of this, it eliminates a lot of that legwork that practices are having to do to manage the case logs and stuff, if you will, there. So unfortunately, I don't have any hardline comparability data on that accuracy, but I can tell you from experience, again, that that we get a lot of high accolades from what we're providing back.
Sure, I think that's good testimony to how well the product is working. So I think that's about the end of the questions that have come in from the audience. So as we move towards wrapping up, Mercedes, is there anything that you'd like to share as some final comments?
No, like I said, just from having been in practice for a long time, and we made up our own databases and our own reports like this. And I think this is an incredible job. And like you said, Michael, surgeons, like, they want to use it right off the bat. So it's kind of, and again, they don't have a lot of time. So you're showing them while they're using it, okay, this works, I'm done. And I think the simplicity and the usability does drive the adoption rate. And, you know, as the surgeons use it, I think they will see the benefits of, you know, with their patient safety indicators, not running the risk of having a comorbidity be considered a complication. There are just so many aspects to this, as well as improving the surgeon's time management and productivity. Like I said, I think it's a very elegant solution, having developed my own little backyard stuff. This is wonderful.
And Karen, one other piece, if obviously anyone who is listening, you know, if there's that one physician that you all think will they actually use it, we're obviously would love the opportunity to show them the product as well, so that you can see for yourself what the reaction would be.
Yeah, definitely. We're really excited to be able to bring this to you today. And just to bring things to a close, you can get a hold of us through the contact information that you see on your screen here. We'll also follow up with an outreach to you with a copy of the presentation, as well as a link to this recording, so that you can share that with your team. And if you're interested in talking with us more about it, we'd be happy to come out and visit with you and have a discussion about the solution itself and show it to the physicians that you'd like us to show it to, as well as have a discussion about where this fits in your product roadmap, pricing and packaging and so forth, in terms of what you have and where you want to go forward with us. So with that, I'll thank my fellow presenters, Michael and Mercedes. Thanks so much for your time and your comments today. And thanks everyone for joining, and have a good rest of your day.
Thank you.